Brevactid is used to trigger final follicle maturation and luteinization following the stimulation of follicular growth. Store in a refrigerator between 2 and 8 degrees. Protect from frost. Keep the inner packaging inside the box at all times to protect the preparation from light. Medicines must always be taken as directed by the doctor. The injection is performed at the end of stimulation, 32 to 36 hours before follicle puncture, at which time no more injections are performed. Always wash your hands before using the medicine. You will receive 1 ampule of solvent and 1 ampule of active ingredient in powder form, a syringe and a large and smaller needles. First open the ampule with the liquid. Then you draw the liquid into the syringe using a large needle and mix together. Move the plunger to expel air from the syringe. Use the smaller needle for the application. The medicine is ready for application. For the injection, choose an area around the navel in the lower abdomen and change the site of the application every day. Use a disinfectant pad at the chosen area. The drug should be administered subcutaneously. Therefore, the injection should be performed at an angle of 90 degrees while holding the subcutaneous tissue. Insert the whole needle into the subcutaneous tissue and slide the plunger back to check whether you're in a vein. If your syringe becomes stained with blood, withdraw the injection and use a different one. If all is well, push the plunger of the syringe to inject the medicine. Dispose of the used syringe and needle in a container. Side effects are not common with this medicine. You may experience headaches, nausea, and lower abdominal pain. At the injection site, pain, redness, itching, irritation, swelling, or hematoma.